Lung cancer has been on the rise in the past few years due to many factors that are causing the lungs to become intoxicated with chemicals and carcinogenic emissions we inhale in our daily life. Lung cancer forms in the tissues of the lung, usually starts in the cells that line the air passages. It is the leading cause of cancer death worldwide in both men and women. There are two main types: small cell lung cancer and non-small cell lung cancer. These two types grow differently and are treated differently. In this video, we are going to highlight the major lung cancer symptoms that you should be aware of. And always remember that early detection of any cancer type can help in fighting its future complications and make it more treatable. For patients who have small, early-stage lung cancer, the cure rate can be as high as 80% to 90%. Most lung cancers do not have any alarming symptoms until they have significantly spread in the body, but many of the early signs of lung cancer can be noticed if they appear to be persistent, and that is when the treatment seems to be the most effective. We are going to share with you many signs that could indicate the presence of lung cancer, but stay aware that these signs can overlap with other diseases symptoms. That is why, in case you are facing any of these signs, make sure to visit your doctor to run the necessary medical tests before making any conclusions. The first sign is a severe cough. If you are a smoker, then you need to know that your risk of lung cancer increases with the number of cigarettes you smoke each day and the number of years you have smoked. Quitting at any age can significantly lower your risk of developing lung cancer. When the cough is persistent after 2 or 3 weeks and is not due to any common cold, then you need to check with your doctor. The second sign is coughing mucus or blood. When your cough has extended to more than 2 or 3 weeks and you start to see mucus or blood, this is a very serious sign that something is wrong in your airways. Even if in small amounts, you need to check with your care provider because bloody mucus can indicate that the tumor is blocking the airways in your lungs. Sometimes bleeding can become severe. Treatments are available to control bleeding. Another you need to be aware of is consistent secondary infections in the lungs. When you are being exposed frequently to lungs infections, such as bronchitis and pneumonia, and you experience repeated respiratory infections, then it is time to check with your doctor to see what is the root cause of your inconvenience. Hearing a wheezing sound in your lungs is often not good. Some people do suffer from asthma or allergies, but in the case when you start hearing a wheezing or a whistling sound coming out of your lungs after climbing the stairs or making any small physical effort, that could be due to the cancer blocking or narrowing the airways. In other cases, fluids could be building up in your lungs, causing the air passage in your chest to become restricted. You feel tired most of the time, even after the slightest activities, and you will hear a sound of whistle whenever you try to inhale and breathe. Moving to the next sign, your voice changes. Whenever someone points out that your voice has been modified, or if you ever realize that your throat has become so sore causing your voice to change, check with your doctor to make sure that there is nothing serious about your case. In many lung cancer patients, the tumor that present in the lungs spreads out to the larynx, causing the voice to change. What you might feel is a small allergy due to changing seasons could be something more important trying to alarm you about your health. The next sign we are going to talk about normally hits all cancer patients, and it is unexplained weight loss. When cancer hits the body, a noticeable weight drop happens, and that is due to the use of energy by the growing cancer cells. If you feel that you are losing weight within a very short period of time, then it is time you consult with your doctor. The next sign in pain that might spread to the bones. Patients suffering from lung cancer will experience at a certain stage in time pain in their shoulders and back, especially when they are laughing or deeply coughing. This discomfort will result from the enlarged nose, whereby the cancer has spread to the lining of a lung or to another area of the body, such as a bone, and this will cause you pain. For those suffering from metastasis, meaning that the cancer has spread to other organs of the body, bone pain is something that they will cause them severe discomfort, especially at night. The pain increases usually with movement, but there are many medications to ease up the pain. Other symptoms that could also be an indication of lung cancer are constant headaches, loss of appetite, severe fatigue, swelling in different parts of the body, and the inability to finish normal daily chores. People who smoke or those who live in very condensed areas near production plants do have the greatest risk of lung cancer, even though lung cancer can also happen in people who have never smoked. However, the risk of lung cancer increases every time you expose yourself to smoke, chemicals, and different types of carcinogens. It is very important you remember that the signs and symptoms mentioned earlier can significantly indicate other types of diseases, as you do not need to rush into conclusions every time you cough. But when many of these symptoms interrelate and persistent for an extended period of time, you need to show the corresponding responsibility to rush to your doctor and run the necessary medical tests that will diagnose your specific case. I hope you did find value in your video. Do not forget to like it and subscribe to the channel for more. That was it for today. Leave your comments below and take care for now.